This is a short webinar about the EHR, AIU, and MU documentation checklist that is published on our website. This webinar is to go over documentation needed in order to process your EHR incentive payment. Lack of documentation is the #1 reason why payments are delayed or rejected. Please use the documentation checklist on our website as a guide, and you can locate this listing by using the following steps. To access our website, please type in healthit.wa.gov. When you access our website, look in the left-hand column and click on Resources. After you click on Resources, look in the center of the page and click on Electronic Health Records, EHR. Once you arrive on our page, scroll down till you find Helpful Tip Sheets. It's the first link titled AIU and MU Documentation Checklist. The first document we'll need is called the ONC certificate. It's from the Certified Health IT product list. It must match the ONC number you entered at CMS on your registration, and it identifies the specific EHR product you use. EHR documentation means proof that you have and are using the EHR, such as the invoice, proof of payment. They must be dated in the program year you're attesting for, a recent contract, or if you're an Indian health clinic or tribal clinic, we can take a current copy of an IHS letter that is dated. First-year applicants must provide 2 of these documents. Second-year applicants just need to give us either invoice or proof of payment. The encounter report needs to be uploaded in Excel. It also needs to be sortable. Upload as document type encounter information. You'll be prompted by EMIP to upload it prior to submitting your attestation. See the grid below for the items that we are looking for in your report. So this is patient name, the date of the encounter, primary insurance name, primary insurance number. If you don't want to give us other types of insurance numbers, that's fine, but we must have a Medicaid or Healthy Option insurance number. If Medicaid is a secondary, you can also include those in your account, and we will need to know what form of Medicaid that is and also that number. If you're applying with group proxy, we also want to know the provider's name or MPI. The MU summary is a report that your EHR system gives you with all of the data for your meaningful use. Upload it as document type MU dashboard prior to submitting your attestation. Objective 1 is to protect patient health information. It's a security risk analysis report that you must run at least once a year. This can be from your EHR, or you can use the security risk analysis resource on our website under Helpful Tip Sheets. We need documentation on Objective 6 for patient-specific education. Only if you're excluding, we need a letter explaining briefly the reason for your exclusion. We need documentation on Objective 8 for patient electronic access, only if you're excluding for broadband issues. This may require a letter from your internet provider if we cannot verify it with our sources. We need documentation for Objective 10, Public Health Measure Number 3, Specialized Registry. If the EP chose to report to a specialized registry, we need proof of submission to this specific registry. Upload as document type Specialized Registry. You may be prompted to upload prior to submission. Other documents that might be required: a PA-led letter. These are for physician assistants practicing in a PA-led FQHC, RHC, or Indian health clinic. The letter must explain how they meet the CMS qualifications of an eligible provider and signed by a medical director or equivalent. Practice predominantly letter. This would be for an FQHC, RHC, or Indian health clinic using the medically needy encounters. If we can't verify by our reports that the EP practices more than 50% of their time in an FQHC, RHC, we will request a letter attesting to this information. We also will require other unspecified documents as requested. In conclusion, please let us know if you have any questions about your documentation Don't let your payment be delayed or denied due to lack of submission or lack of understanding. Please see our resources for contact information and website information. There's information here for both us and for Department of Health as well as CMS.